also called a lower facelift or a lower rhytidectomy, the more scientific term, is something that's used for four things. Number one, to treat the laxity of the skin in the lower face region. Number two, to treat this puffiness that sometimes people have, their double chin, the extra fatty collection. Number three, the jowls, which people really don't like. And fourth, the banding in the neck, sometimes called turkey neck. Many people come to us and they think, I just want to have the lower face treated. My upper face is fine, my eyelids are fine, and so they just want to confine what they feel is the part that has been aging for them the most and keep the rest of it pretty much the same. A neck lift surgery especially cannot stop the aging process, and it also can't change the deep anatomy, such like a very prominent Adam's apple. So those are things that it can't do. Now, neck lifts are done surgically. Non-surgical treatments just don't work the same as a neck lift. It can't really get rid of the extra skin. There's some things that can be combined with it that might make it easier in the future for select patients, but a neck lift is really a surgical procedure. The procedure is going to be something that you worked out with your surgeon. It may start out with a procedure where the incision's made around the ear, comes back behind the ear, and then there's a dissection that goes down to where the problems are that you were concerned about, and then addressing the things like the double chin, the bands in the neck, the jowl areas. Those things are then sculpted down, taken care of, then the skin is brought back and any extra is removed. Oftentimes, patients will have a small tube that runs from behind the ear down to drain any extra fluid that might collect to try to speed the recovery period. Secondly, some surgeons use bandages, others don't. Everybody, I think, feels it's important that the head of the bed be elevated and the patients stay elevated so they don't collect a lot of swelling. And finally, to make sure that the chin doesn't flex down. So it tends to be a very straightforward recovery process, and then your surgeon continues to see you. You come back, you have sutures removed, the surgeon continues to follow you for months, for a long time after your surgery to make sure you're very happy with the result and that you're well cared for. The neck lift results can usually be seen pretty soon after the surgery. Now that doesn't mean that there isn't some swelling and bruising, but that tends to go away quite rapidly, and you can see results soon even though the swelling isn't down completely and the healing isn't completely done. But results are seen early. And then as you follow up, you try to make sure that you maintain a healthy lifestyle, try to avoid sun, and do everything you can to keep this neck procedure going for you.